In this video, we will discuss how to monitor your heart failure status and symptoms.
It is important to monitor your symptoms regularly to understand if your heart failure is improving with medications or if it is worsening and you may need additional attention from your care team.
In the Engage-HF app, we use 3 tools to monitor your heart failure symptoms: the Kansas City Cardiomyopathy Questionnaire 12 or KCCQ12, the Dizziness Questionnaire, and the Daily Health Status Question. The KCCQ12 is a set of 12 questions that assess how heart failure affects your symptoms and quality of life over the last 2 weeks. Your responses to the 12 questions lead to scores in 4 different categories. Each score goes from 0 to 100, with lower scores meaning major limitations related to heart failure and 100 indicating minimal limitations related to heart failure. The Engage-HF app asks you to complete these questions every 2 weeks to track if you are improving or may need additional attention.
The first category is physical limitations, how your heart failure affects your ability to do physical activities such as doing daily activities, running, and walking.
The second category is symptom frequency, how often you have swelling in your legs, trouble lying flat when sleeping, fatigue, or shortness of breath. The third category is quality of life, how you feel heart failure affects your overall quality of life. The final category is social limitations, how your heart failure impacts your ability to see your friends, do hobbies, and work around the house. Each of these 4 categories are averaged to give an overall KCCQ12 summary score.
The KCCQ12 scores are useful for many reasons. This score is a strong predictor of someone's risks. A higher score not only indicates you are feeling better but also that your risk of being in the hospital or dying is substantially lower. The KCCQ12 is also useful to track over time to understand whether someone is getting better.
An increase of 5 points is generally considered a small improvement, and an increase of 10 points is a large improvement. An improvement in your score means a lower risk of being hospitalized for your heart failure. On the other hand, a decrease in the KCCQ12 score of over 10 points can show to your clinical team that you need additional attention and indicates a higher risk of being hospitalized. You should set a goal for your KCCQ12 and see if increasing your medicines and making lifestyle changes like increasing your activity and monitoring your weight closely help you achieve that goal. A good goal is to get your KCCQ12 summary score to above 80%, or to 15% more than your initial score if it started below 65. In addition to doing the KCCQ12, the Engage-HF app asks you each day how you felt the prior day in terms of your heart symptoms, your breathing, your swelling, and your dizziness. This is less detailed than the KCCQ12 but gives a quick picture into how you feel between your 2-week surveys. This can help identify if you start feeling worse and can also help you and your clinical team connect if how you felt is connected with your weight or your blood pressure.
A major goal of treating heart failure is to improve how people feel. The KCCQ12 and the Daily Health Question can help you and your clinical team closely track how you feel over time in a standardized, accurate way. This can help you see the improvement in your heart and detect any signs of worsening.